Training in independent living skills to the visually impaired person is very important to make them as equal as normal persons in the society. Visual impairment makes them to learn these skills difficult because they cannot see. They cannot learn informally by observing the actions of others. Activities of daily living includes all those things that people do every day: getting dressed, bathing, using the toilet, washing clothes, shopping, cooking, eating, cleaning the house, and many other activities. The basic skills involved in making beds, for instance, or sweeping the floor or shaving, are usually learned by watching one's parents do these activities. Often, visually impaired persons do not have to learn any special techniques for these activities of daily living. They can follow the same steps as a sighted person and need only to be taught the correct procedure. In bathing, for instance, there is no difference between the way a sighted person and a visually impaired person wash themselves. They both must use soap and water. The procedure is the same. Sometimes, however, a special technique may help the visually impaired person do some activities more easily. These techniques usually make use of other remaining senses, sense of smell and sense of taste. To fill a glass of water, sighted person pours water into the glass and stops when he sees that the water is almost to the top rim. A visually impaired person must use either a tactual or a hearing clue to know when to stop. If a sighted person wants to wear a yellow shirt, he can easily pick it out. The visually impaired person must have some kind of tactual clue to differentiate between yellow shirt and white one. Therefore, it is important for the visually impaired person to master as many of these skills as they can, so that they need not depend on others. If they must wait until someone else can help them, this is an inconvenience not only to others in the household, but also to the visually impaired persons themselves. Thus, activities of daily living include all these activities which people do every day. Training a visually impaired person in these activities would enable him to become self-reliant, independent, and more confident in his routine activities. Although these activities are not end of itself, these certainly are a very essential means toward complete, meaningful, and comprehensive rehabilitation. Enable the visually impaired person to carry out his day-to-day activities with the least possible external assistance and with safety. Should help him to be self-sufficient in all functional activities. Create confidence and encourage him to become socially integrated. Develop healthy personal and family relationship. Help him to learn self-management and home. Should become aware of safety precautions. Reduce dependence upon the caretakers and develop a positive self-image. Should become well-groomed person. Training strategy. Due to lack of visual perception as well as discrimination, it is difficult for a visually impaired person to learn daily living skills on his own. Most of the daily living skills are of routine in nature. He does not need to learn any special techniques for performing these skills. However, it is essential to train him for the particular procedures involved in performing the activity. In swimming, for example, the person has to follow the same step as a sighted person, but may need to be given special training in safety matters. Rules for teaching daily living skills. Gather all materials and equipment before starting the activity. Be sure that the visually impaired person knows where these materials are and can locate them easily. Be certain that the visually impaired person can use each implement or piece of equipment, that is knife, stove razor, fork, correctly and safely. Have a work plan that tells you the correct procedure to use and lists each step in the proper order. After the activity is completed, be sure that your client cleans and returns all equipment and supplies to their correct storage space so that they can be easily located later. Follow up and evaluate and appreciate good performance. When visually impaired persons are well organized, they can work safely and with ease. Loss of vision labels a person as a disabled or impaired. Because of his disability, he may not do things that the others of the same age and sex can do, such as walking, looking after themselves, household tasks, etc. Though the visually impaired persons are capable of doing many activities and can become independent, but they are kept dependent by the society by its own ignorance. Self-care is an independent activity. Any individual should grow by learning all these self-care skills. Importance of learning self-care skills. Self-care skills make an individual look graceful and create confidence. It acquires personal independence. It develops proper attitude towards sighted persons. It enables them to learn self-awareness. It gives them an opportunity to learn sense of responsibility. It helps them to make decisions. It develops better communication skills. Self-care skills will enable them for social interaction. Self-care skills are very important for the visually impaired persons. Learning these skills, they need not depend on others and they manage by themselves. This develops self-respect and confidence in him. These skills should be taught from the childhood by their parents. Then most of the activities will become regular habits and they will never forget till the end of life. Posture and gait. Posture and gait play a vital role in the mobility of any individual. Vision is very important to correct one's posture and gait. Loss of vision leads to different unwanted mannerisms and it develops problem in posture and gait. This will create difficulty in free and independent mobility of visually impaired persons. Posture. It is the way in which the body is positioned when a person sitting, standing or lying down. Position of a person's body or body parts. Positional relationship of the different regions of the body to each other. Use of a good posture. Posture keeps bones and joints in the correct alignment so the muscles are used properly. It helps decrease the abnormal wearing of joint surfaces. It decreases the stress on the ligaments holding the joints of the spine together. It prevents spine from becoming fixed in abnormal positions. It prevents backache and muscular pain. It contributes to a good appearance. Static posture. Static posture is any posture that is held for a long time. A static posture may result in fatigue and even injury over time. Example, sitting, standing, etc. Dynamic posture. It means movement patterns and alignment of a person's body during activity. Example, running, walking. Gait. A manner of walking. Forward propulsion of the body. Term used to describe the style of walking. Use of gait. Evaluating the walking pattern of a person to identify any damage to the muscles of the body. Parents and teachers of the visually impaired children should observe the posture and gait problems and give corrective exercises. Correct posture and gait make an individual function smart and look graceful. Hygiene. The first one is bathing. Bathing techniques are the same for the sighted and visually impaired persons. Before bathing, the visually impaired person should be oriented the bathing area. He should know where to hang his towel and clothes, a safe place to keep the soap so that it does not fall into the water, and he should find correct place to bathe in. He should also be shown how to fetch the water that he needs, whether it comes from a tap, a well or a stream. Visually impaired children should be taught to wash themselves all over their bodies and just their hands and faces. Brushing teeth. It is very important to teach this skill while children are still young, as it will keep their teeth healthy and help them develop good dental care habits. Normal children usually learn this skill by observing their parents brushing their teeth. For visually impaired children, it is difficult to teach this skill. While teaching this skill to the visually impaired children, there may be some difficulty in placing the toothpaste on the toothbrush. To avoid getting too much toothpaste or missing the brush altogether, have the person follow these steps. Hold the brush in one hand with the bristles between the thumb and forefinger, so that the handle of the brush is free and the bristles are facing up. With the other hand, hold the tube of the toothpaste and place the opening of the tube at the either end of the row of bristles. Gently squeeze the tube. As the toothpaste come out, move the tube along the top of the bristles to the end of the row. The thumb and the first finger will help keep the toothpaste from falling off the brush and will give a tactual clue to the amount of toothpaste. Another possible technique. Squeeze the toothpaste into a finger and then rub it directly onto the teeth. Point to remember. Teach the visually impaired children the correct method for brushing the teeth using downward motion for the upper teeth and an upward motion for the lower teeth. Discourage a back and forth brushing motion. Care of hands and feet. Visually impaired persons should be taught how to maintain their hands and feet clean always. This activity should become a regular and should form a habit too. They should be taught to clean their hands before eating and keeping the hands always clean. Nail cutting. They should be taught to keep the nails clean always. They cannot understand how much dirt accumulates under the nails. They also not aware dirt would go along with food and cause diseases. Therefore, it is very important that the nail should be cut at least weekly once using nail cutter. Grooming and that hair care. Good hair care is important for everyone. The visually impaired person needs to know how often to wash her hair and should follow the same procedure as the sighted. The amount of shampoo and hair conditioner, if used, can be controlled if it is poured first into the palm of the hand rather than directly onto their hair. After combing the hair, the visually impaired person can use her sense of touch if her hair is combed correctly and is in place. Shaving. Techniques same for the sighted person and the visually impaired person. The sighted person has the advantage of using his vision and make work easy with safety. The visually impaired person must take more precautions while doing this activity. No matter what kind of equipment is to be used, work slowly so that he does not cut himself. The sense of touch will be important in checking whether he has shaved all areas of his face and neck. It is best for the visually impaired person to follow the same shaving pattern every day. Each time he shaves, he should start in the same place and follow the shaving pattern. Observe the following precautions. Double-edged safety razor is more safe. Downward movement of razor is advisable and the same pattern to be followed every time. Check with the hand if all areas of the face have been shaved properly. Electric shaver is safe and convenient, but it may be expensive. Using cosmetics. There are many different beauty aids: face powder, perfume, skin lotion, lipstick, eyebrow. It may be difficult for the visually impaired to select the color and the shade. Therefore, they seek the help from the sighted to teach how to use cosmetics. Sense of touch will be useful to the visually impaired person to check his or makeup is applied correctly. Using nail polish by selecting colors, she can seek the help from the sighted. Dressing. Visually impaired persons should learn how to wear clothes like the normal persons. Wearing clean and neat clothes give anyone so much of grace in a community. Dressing is a very simple activity and easy to learn. Identifying clothes. There are several ways for visually impaired persons to identify their clothing: by the material they made of, by the special design or pattern, by special markings added to the clothes. Washed and clean clothes are always give good smell. Social graces. Visually impaired persons also live in society and they also should follow the same rules what the society follow. They should learn social manners, etiquette and courtesy. Neat and clean dressing gives them an acceptance by their sighted friends. Proper posture should maintain while eating, walking, sitting and talking. This will give proper recognition from their sighted friends. Avoiding unwanted mannerisms will bring grace and respect. Art of conversation with others will bring social grace. Toilet activities. Visually impaired persons must follow the same rules as the sighted family members in keeping themselves and the toilet area clean. This is important for the health of the individual, family and the community. Visually impaired persons should be taught to use the toilet properly. Travel independently to the toilet and well oriented the toilet area. Locate the correct spots by tactual method. Locate the water tap to clean after he is finished. To use soap to wash hands. These are an individual activity and do this without any help. Eating is a skill and children learn this skill from their childhood. Parents are the teachers to impart the skill and it becomes a social skill. Eating is hand-mouth coordination and it does not require sight, but one should know where are the food kept and what items are there in the plate. This may be a bit difficult for the visually impaired persons in the beginning. By properly instructing this skill to the visually impaired person while eating on the table, they will use this skill without any problems. Position of the food on the table. It is much easier for the visually impaired person to locate the food on the table if it is always placed in the same spot. There is a simple and useful technique to locate the food on the table by using the hours of clock as a verbal guide. The center of the plate would be like the center of the clock. The top of the plate is 12 o'clock and the bottom is 6 o'clock. Therefore, the rice would be at 1, the side dish is at 2, drinking water at 9. It is easy to do this and it will allow a person to identify the food without touching it with his fingers. This technique can be used, the person is using plate, a banana leaf or a tray. Etiquette. Etiquette is the customary code of polite behavior in society or among the members of a particular profession or group. Eating is a skill and it is important to know eat correctly. It is a social skill and it gives grace while dining with group of people. Everyone should learn table manners while eating in a group. It is essential to maintain a proper posture while eating. The local manners and customs which are to be observed while eating must be taught to the visually impaired persons. It is easy for a person to feel what food he is eating and how much if he eats food with his fingers. The system of coordination of fingers is the same for both sighted and the visually impaired. The proper way to hold and use a spoon and a fork is the same for both sighted and the visually impaired. Generally, the fork is held in the left hand and spoon on the right. While eating, avoid talking loudly and laughing because the food may spill on others. Handling money is common for everyone in the community. One should know the use of money in our day-to-day life. Money is important for life. Without money, it will be very difficult to maintain our life. Visually impaired persons also should learn to use money for their daily needs. Therefore, they should know how to identify coins and currency notes and their value. Coins. In every country, coins can be used and easily can be identified as their sizes, weights and types, edges. Visually impaired persons should learn to know the size and the weight. The tactual sense is very useful in identifying the different denominations. In India, there are different coins are in use: 1 rupee, 2 rupee and 5 rupee. They are in round shape and different sizes and weight. The visually impaired persons should be used their tactual sense to identify the coins. If they get confused in identifying, then they should seek the help from the sighted friends. Continuously using the coins, it will be easy to identify the coins by a simple touch. Currency notes. It is generally difficult for visually impaired persons to identify the currency notes. In India, currency notes of 1 rupee, 2 rupee, 5 rupee, 10 rupee, 20 rupee, 50 rupee, 100 rupee, 500 rupees and 2000 rupee. The rupee 1 and 2 currency notes are almost not in use. Even 5 rupee note also not much in usage. The other currency notes 10, 20, 50, 100, 500 and 2000 are in use. The visually impaired persons find it difficult to identify the difference between these currency notes. Of course, every currency note is slightly different from the other in size and length. Initially, the visually impaired persons must be taught the value of each currency note and must learn the difference of the each note. There are different methods for identifying the notes and its values by the visually impaired persons. Still, it is better to confirm from the sighted friends or relatives or trustworthy persons to find out the correct notes. This will give them authentic information and real satisfaction. Or he will have suspicion in his mind. Continuous practice in use of money in day-to-day activities, the visually impaired person gain experience and easily handle money without any confusion.